G'day, hello, Marlene. G'day, Dom. How are you? So, now I'll put that right there. So, we'll just kick off with health, if that's all right, and then we'll the doctor's here, so we'll do health first, and then we'll come to other matters, if that's all right. So, everybody ready to go? And just watch yourself. We've got people watching out on the bikeway. It's pretty busy through there. Camera's okay? You want sound? All good? Thumbs up? Cool. Okay. Great to join everybody here this morning. We'll kick off with the health report for the overnights. We have the Chief Health Officer, Dr. John Gerard, here. He will go into it more in depth, but I can report that we've had 4,265 new cases overnight, of which 2,119 were positive RAT tests. So we have 34,081 active cases in Queensland at the moment. In terms of testing, there's 9,434 samples have been tested in the last 24 hours, so still a lot of testing going on, which is good to see. It's my sad duty to report that there have been 2 deaths overnight. A person in their 70s and a person in their 80s, both of them not vaccinated, and one of them, I believe, in aged care. For further details, I'll ask the Chief Health Officer to address you. Thanks, Doctor.
Thank you very much, Minister. So sadly, we have 2 deaths to report today. One person in their 70s and one person in their 80s. Neither was vaccinated. One was from a residential aged care facility. Whether it's 2 people or 20 people, it's always a tragedy for the families involved, so we send our condolences to the families involved. The situation in general with regard to COVID-19 in Queensland continues to improve significantly. There's been a fall in the number of inpatients again. We're now down to 365 people in public hospitals in Queensland, down from 391 yesterday. That includes 33 patients in intensive care. In our private hospitals, we have fallen slightly again to 21 inpatients with COVID-19, down from 23 yesterday. In terms of school-aged children, the numbers are actually fallen in the last 24 hours. We're reporting 1,381 cases in school-aged children between the ages of 5 and 17. That's down from 1,507. The main thing we're looking for there is whether there is any increase, and there has been no increase in cases among children, no significant increase in the last couple of weeks since the schools opened last Monday week. And there have been no increases in the number of children admitted to hospital with COVID-19 since schools opened 2 weeks ago. I might hand back to the Minister.
Thanks, Doctor. Any questions on health?
Did you say the amount of new cases again?
Yes, I can. Let me just find it, set that back, of course. 4,265 new cases, of which 2,119 are positive RAT tests, and we have 34,081 active cases with 9,434 tests in the last 24 hours.
Just off the back of that, obviously we keep seeing case numbers falling. Have you now made a decision that these pressing daily updates will end sometime this week?
Look, that'd be a matter for the Premier rather than myself, but I'm sure there'll be further news to progress on that. We are seeing the hospitalisation numbers come down, which we're very pleased to see, but look, there's still virus out there, so people need to get vaccinated if they haven't. It's not too late to get the vaccination. People need to get the booster. It'll give people an extra layer of protection. So even though the numbers are improving, we're still seeing people die and this virus is still there. So people need to consider their health still and make sure that their health is their number one priority.
Dr. John Gerard, just one for you. In regards to boosters, obviously we're doing our third booster. Some of our colleagues who's immune compromised have to get their fourth shot
Yes.
now. Do you think all of us will be getting a fourth shot eventually? Maybe just before?
That's a very good question, and that's something that ATAGI will need to consider as the winter approaches. So it is a good question. Australia will be heading into winter before the Northern Hemisphere, so on this occasion we won't be able to see what's happened in the Northern Hemisphere in making our plans, but that will be a decision for ATAGI to make.
With the border opening tomorrow, you said you don't expect too much of an impact in terms of the numbers. flu obviously arrives from overseas initially. When do you think we might start to see that virus re-emerge here?
Again, it's one of those unknowns, and we need to be prepared for influenza, and we are going to be strongly encouraging people to receive influenza vaccine when it arrives, which will likely be in April. So we are going to be strongly encouraging influenza vaccination in the coming weeks, because there is a significant chance that we could have both viruses this winter.
With such low numbers now, is it time for restrictions to return?
Well, we're going to be discussing this next week.
Like the Nurses Professional Association of Queensland says there are chronic staff shortages among nurses across the state, in particular on the Gold Coast. Do you believe there are as well?
Look, it's not something I would comment on. No, this is something that's a question really for the Health Minister. We're talking about in hospitals or in aged care facilities. Look, that's not a question for me to address. It's a question for the Health Minister.
You mentioned previously the number of wards that are dedicated to COVID. Is that controlled?
It is. There are few, if any, hospitals, and I can't be certain. I'm not sure if any hospital in Queensland has more than a single ward, which is what we probably will be expecting and aiming for. I imagine this virus will continue to circulate in the coming weeks and months, and I think most major hospitals will need to maintain at least one COVID ward available, and that's what my expectation of what it will look like going forward. Now, whether it expands beyond that as we approach winter, that's what we don't know.
Do you think flu would sort of be incorporated into that? Or
No, we would separate influenza from COVID-19.
And do you think you're able to now ramp up for elective surgery given those rooms?
That's the question we'll again be addressing in the coming weeks, but we've always talked about that as we go into March.
And just finally, you talked about school numbers that keep seeming to drop, and you're not seeing that huge spike that you were originally predicting. Do you
Yes.
think that this is just a much more mild disease in children?
No, I think what's happened is yes, it is. We know it's a mild disease in children. So first of all, we know that the vast majority of children have a very mild illness. There's no question about that. But also there was quite a significant epidemic among children about two to 3 weeks before schools opened, which vindicates the decision to delay the opening of schools. So we would not have wanted to open the schools at the peak. And the main reason was because of the disruption, not because we were particularly unduly concerned about the health of any individual child, because we know it's primarily a mild illness. But to have opened up at the peak would have caused significantly more disruption had we not delayed by a couple of weeks. So yes, there was a much larger peak about 2 to 3 weeks before the schools in fact opened.
Are you being surprised by those numbers in school-age children? Because we were warned about outbreaks and the numbers were
Pleasantly surprised, yes. We thought there could be significantly more, but this has happened across the country. There's been a slight bump, but not a major rise. So we're pleasantly surprised. Yes.
at what point do you think we might be able to say that those numbers in schools are sort of plateauing? There's no reason why they should achieve that really
So, but let's remember, we are talking still about 1,000 to 1,500 children a day with COVID-19. If we had said that 3-4 months ago, I think people of Queenslanders would have been shocked. But we realise now that this virus in children, we know that this virus in children is mild, and that the adults, this is probably the single most important thing, the adults have been protected through vaccination. We are just not seeing the severity of illness in adults that we would have were it not for vaccination. It's not because of Omicron. Omicron is not the reason why we are not seeing large numbers of people in hospital, large numbers of people in intensive care. It's because of vaccination.
We've had sort of 2 weeks of school now. At what point do you think those numbers are about where they're going to be? Because we've had 2 weeks of school, that should be enough time or enough for it to transmit it through large numbers of students. If it was going to happen.
I haven't seen any specific modelling on this, so I'm not sure where this is going forward with children. But I mean, it's clearly, it does not appear that there is a significant rise in cases. I think we would have seen it by now, and it's good news so far.
Just about just on
Can I just ask a
Yeah, sure.
Do you think mask wearing and airports will just be here to stay quite some time?
Well, mask wearing.
Mask wearing and airports will be here to stay.
Look, let's not get down to the specifics of where we're going forward with the mandates. Let's not.
That'd be a good idea.
No, let's not discuss further the mandates. I think we decided we would wait until next week before discussing that publicly.
I'm not sure if you can answer it under the staffing issues, but are you seeing any impact of all those
We saw a slight. There was a slight increase in absenteeism among hospital staff we saw at the end of last week. We were wondering whether that might be due to school children, but it wasn't substantial. So I don't have any up-to-date figures. There seemed to be a slight increase, but it wasn't dramatic.
Bailey, just on through the borders reopening following COVID, is this, I guess, the salvation that our state needs when it comes to the tourism dollar return?
Well, I think it's another step forward back to normalcy, and I think it'll be good for our economy. It is part of our plan to ensure people's health, but also to gradually reopen as it's sustainable. You know, we've acted on the health advice from day one. We were the first state to declare a health emergency. That's why Queensland has been one of the most effective jurisdictions in the world, and we're still absolutely committed to being so.
Just finally on that, what sort of boost do you think it means to our economic bottom line coming months?
Oh, look, there's no doubt, particularly in our tourist areas, particularly Gold Coast and Cairns, who really rely on tourism and have missed those international tourists for the last 2 years, that they're going to benefit from that, and that's a good thing. So, I think they'll be relieved and supportive of the international borders reopening. Look, every workplace has been affected by the Omicron wave, right across this state, right across the country, and it's been a matter that's needed to be managed. Fortunately, the Omicron wave in Queensland has been a lot lower than our most optimistic projections, so the ability to manage that has been better than we expected. I think that's positive, but of course, management has had to make those decisions to ensure the services continue at Gold Coast like everywhere else. Now we might just do e-scooters if that's all right, and then we'll go to all the other stuff if that's fine. So thanks, Doctor. Okay, so look, we're here today to discuss some initial reforms in terms of e-scooter regulation. What we know is that e-scooters, since they've been legalised in Queensland in 2018, have been incredibly popular. In fact, nearly double the national rate of people using them here than in other states. And I presume that's because we've got beautiful sunshine, great weather, very conducive to using them. They're very popular. But because it's a new form of technology, it's also an area that's emerging and evolving in terms of how we get the balance right in terms of safety. And it's been my concern that we still have work to do in that regard. As a cyclist and a runner myself, I've seen them in action, a lot of people doing the right thing, some people not doing the right thing, and it's an area that I think we could improve upon. So that's why I had a roundtable last year of everybody across the spectrum. We had the providers, we had the sellers, we had the police, we had people from the disability networks, from the active transport area. We all got together for a solid half day of going through all the issues and nutting out solutions and working out what's the best way of doing things. So over the Christmas, January period, we've been looking at some of those matters in detail. Some of them will require more work and working with stakeholders and local government and that sort of thing. Others are a little more straightforward, and that's what we're announcing here today. So one of the issues, and I welcome Neuron and Beam here, who are providers of the syndicated e-scooters, and thank them for working with us, and the Queenslanders from Disability Network also here with us, who I'm sure would be willing to say a few words as well. What we want is a balance that everyone's pretty happy with, and so what we're finding is that a lot of pedestrians feel threatened when they're ridden on the footpaths in a way that's too fast, and they feel unsafe. One of the main issues as well that I was concerned about as the Minister is to hear that people with disabilities are feeling so threatened that they're actually moving around in their community a lot less, particularly people with visual impairments, but people with all sorts of other issues, that the interactions there need improving. So what we're doing today is bringing in a number of new measures for e-scooters. We're dropping the maximum speed on footpaths by half, down to 12 kilometres an hour, so that they move around pedestrians at a much more predictable and reasonable speed. But we're also allowing e-scooters more places to ride, so we can get them off the footpaths altogether. So we're going to be allowing them to ride in veloways, so basically the bicycle freeways, and also protected, separated bike paths. So one like you're seeing right here. If anyone had any doubt about popularity of active transport, the volume in the last 20 minutes would tell you well and truly how popular it is. So where there's that protection, we're going to be allowing the e-scooters to share the space with bicycles. So I think that's a common sense and sensible measure to move forward. We'll also be having a safety campaign that really puts out there what the key issues are and how to ride them responsibly, around other people, ensuring people have got a helmet, those sort of safety measures if something goes wrong. And we'll be putting that out there, and we'll be working with all the different sectors on how to do that to make sure everyone is aware of what's involved. One great idea that came out of the round table, really simple one, was the need for when people buy their own e-scooters. They're so popular that, of course, some people are buying their own rather than using Neuron and Beam. At a point of sale, have a simple booklet that tells people the safety measures. It's really easy to take away, and they'll be a better rider as a result. So we'll be working with the providers and other parts of the sector to get that right. And also, I think the other issue that concerns me is how they're parked in a very unregulated way. So for people with particularly visual impairments, they're incredibly fearful about falling over them because they can be anywhere. So what we'll be doing in this regard, and I've spoken with mayors, Adrian Schrinner, Tom Tate, and also the President of the Local Government Association, Mark Jameson, is we're going to work with local government, who basically, they have control of 95% of the footpaths out there, and the different sectors, to work out how do we get a parking scheme that's within reason in terms of how people use them, but keep the e-scooters out of the way of everybody on the footpaths. And I'm sure we can work our way through the logistics of that. I think it's the right of any pedestrian, particularly people who have disabilities, to have a clear footpath to get where they want to go. And footpaths, of course, already have some things in them. They have street furniture, they have street trees. We've just got to work out a simple way that people know how to park them, that stays out of everyone's way, that's not very expensive. I think we can work something out there. So I'm very committed to working with local government and the different sectors so we can make sure that that safety thing, particularly for the vulnerable in our community, are looked after. Now, I have a number of people from Queensland Disability Network here. Would you like to say a few words? Come on in. And then we'll go to you guys.
Sure. It's Alicia Matthews, ELISHA MATTHEWS. I'm with the QDN Queenslanders with Disability Network, and this is great news for people with disabilities today. We understand that e-mobility is something that people are going to keep using, and I welcome it because that's been part of my life for a long time. But access and inclusion should be for everyone. Inclusive access is for everybody, but it shouldn't come at the cost of people with disabilities. So having everybody on the same page together means that people remember that I'm still here and that I need to use the space too.
How frustrating is it when you're going from a park and there's an e-scooter right in front of your phone?
I'm late for a lot of appointments. It's really frustrating because there's no other option for me. I usually have to find another way around, and it can be a very long journey, and sometimes I'm just completely blocked. So there have been times where I've had to rely on the goodness of strangers that I can flag down. So it's the equivalent to cars that park on footpaths, and it's just another added intrusion into my day.
Have you ever felt unsafe?
Consistently. It's very hard for me when I'm travelling on a footpath and there are other users whizzing by at a speed where I'm not able to judge whether it's safe or not for me to turn. I've had a lot of very close misses. I've got a lot of friends who have had impacts and injuries from that. So we're really hopeful that this means that is going to reduce dramatically.
Are you happy with those
speed reduction and some regulations on parking?
Yeah, I think that it's certainly one way to start regulating it, but education is going to be key. If people don't know what the rules are, they don't know that they have to follow them. So having the companies now assisting us with educating users is going to make the biggest impact.
Cool. Thanks, Alicia. That was fantastic. And who wants to go first?
You're right.
Tom Cooper, General Manager for Beam, Australia and New Zealand. Yeah, absolutely. So Beam's very supportive of the legislative changes that lead to safer outcomes for the entire community. Education is a key part of that, and so we're going to be working really hard with the Minister, Brisbane City Council and other operators to make sure that these educational messages are shared amongst the community.
That speed reduction to 12 km an hour, is that just something you can just program into your scooters and make it more slow that speed? Is that how it's working?
No, this is an educational piece, so we won't be enforcing it. We'll be educating people that that's the rules. Like speed limits with cars, that it's the rules and you need to follow them.
So how do you police that? Is someone holding a radar going that you're going to find? I mean, how do you police that?
So we're going to be working with the Minister.
Through education?
Through education, yes. Yeah.
So if I park across a footpath in a car, I get a fine. Is that something that can happen to users if they just leave their scooter in the park or something?
So we run a 3 strikes policy where if people are parking inappropriately, we can warn that user and then educate them on how to park properly.
How fast do the beams go?
They can do up to 25 kilometres an hour.
So people technically still do finding that.
That's correct.
Why not go program the scooters so they might go faster?
Well, at the moment with GPS capabilities, it's very hard to dictate between the footpath and a cycle lane. Often they're next to each other. So we want to encourage people to use cycleways and shared paths, but if the speed limit drops, then it's going to cause other issues for cyclists as well.
Sure. Jaden Bryant. I work for Neuron Mobility. Sure. So since 2019, we've done 6.5 million kilometres on Neuron scooters in Brisbane. We're really excited about some of the announcements that have been mentioned today by the Minister. We're looking forward to working very closely with the parking working group, and it's something that we're quite passionate to resolve, especially for some of the reasons mentioned. That's pretty much it.
Any differences, I guess, for yourself? Will you be programming Neuron scooters to go a certain speed, or is it education as well?
So there's already slow speed zones around, but as Tom mentioned, it is difficult to determine between the footpath and the other road, and you create other safety issues. We do have a speed mode 1 button on our scooter, which will drop it down to 15. Still not the 12 that we need, but we can look at doing that as well.
Why does this take them so long? We've had e-scooters since 2018.
Well, I think this has been an issue as a new technology. We needed to see how it goes, but I think the conversation in the community was very clear that they wanted a better, upgraded sense of regulation, and that's what we're responding to. In terms of enforcement, Queensland Police are very much a part of the roundtable. They do enforcement at the moment, both in the late night precincts, also on bikeways like right here. I've seen them actually enforce the speed limit there. Of course, the speed limit in terms of the 25 kilometres an hour is not an issue really with Neuron and Beam, who have it the software regulated in that regard. Some of the private users, majority I think are doing the right thing. Some of them do go a lot more than 25, and those sorts of cowboys in the e-scooter community, we want to sort them out, because when you're doing 45 or 50 on an e-scooter that's not built to do that kind of a speed. I actually saw one on Palaszczuk Road last week, and the guy seemed to have a death wish because no protection, it doesn't even have the centre of gravity of a bicycle, and yet he was in traffic on a road, clearly doing it illegally, no helmet, just crazy stuff. That sort of stuff we want to stamp out. Gives the responsible e-scooter riders a really bad name, and it's just simply unsafe for everybody.
Police currently have the power to fine people doing a lot of things on e-scooters.
Yeah, look, they do, but the regulatory framework is one that we want to improve. So that's something where there's a number of areas we'll continue to work on. This is a first raft of e-scooter reforms. It's not a final package. So these are the things that I believe are straightforward that we need to do as a first raft. A few other things we'll be working on with different agencies will take a couple of months or a little bit more time. So I'll be coming back to you with another round working with stakeholders that will improve the regulations as well, and that will be one of them, because some of those definitional things and how we enforce, police want to be able to enforce it better, and we want them to be able to do that. We've just got to work our way through the tin tacks of how we do that.
So there'll be some kind of fine system in place in some circumstances?
Yeah, look, absolutely. If you're speeding in a car or a truck, you get fined. If you're speeding on an e-scooter, you should get fined as well. Simple as that. I absolutely believe that. You've got to ride or drive safely. That's the principle.
So what's the regulatory issue that you've got? Can they not find people on a scooter in certain areas?
Well, at the moment, it's not classified. The classification is there to allow them to go on footpaths. So we can enforce some provisions when they're on a road, but not on a footpath. So we need to be able to resolve that so that the regulations are, for instance, drink riding is an issue. I want to see that stamped out as well. I mean, if you're over 05 and you're on one of these things, you're unsafe. So there's a few of those complex issues around, is it a vehicle, is it not a vehicle, what implications that has for enforcement, that we're working with police and stakeholders on.
So at the moment, you cannot get a fine if you're speeding a footpath on an e-scooter?
Well, we're bringing in a speed limit for the footpaths and bringing it down,
but they can't get fined even when that speed limit's in?
No, well, that's my understanding. You can get fined if you're on the road and doing it in a way that's illegal, but the footpath regulation needs a little bit more work. Well, it will be able to be enforced. That's the intention. So,
Well, just get fined. What happens to you if you get caught speeding?
Well, you can get fined, but it'll be a new provision in which the police can enforce it at 12 kilometres an hour on a footpath. So obviously we would target that to where there's an issue. A lot of places that's not going to be a significant issue, but the speeding at the higher end, I want to see some fines that are appropriate to people be doing. If someone's doing 45k along Bicentennial Bikeway, they should have the book thrown at them. Simple as that.
Don't you think fines should have been appropriate 4 years ago though to ensure safety?
Well, yeah, fines are. There are some general fines, but in terms of using active transport infrastructure. But this is a new form of moving about, and we've got to improve things, and that's what this package is about.
How long before we see footpath fines then?
Well, we're looking at that, and I'm not announcing timetable today about some of these reforms. I'm just simply announcing what our reforms will be. But we'll have more details about when they're implemented, and we want to make sure that when we implement them, they're enforceable. So there'll be some more work done around that. But I think some of these reforms, I think the community will really like to see.
Given they're so widely used on public footpaths, though, and given the safety concerns, should the onus be on companies then to program the scooters so they veer onto the beam so they can't go up a certain speed? Would you welcome that?
Well, I think. Being able to, you can geo-fence them in certain areas, but being able to delineate between a footpath and a roadway is a lot more problematic. So we would work with the providers about this. There has been geo-fencing in some other areas. That is an option, but we'd want to be able to work with the providers in those specific locations.
Is there a reason why you came up with the 12k limit as well, based on any data about, say, frequency of, I guess, higher speed incidents or accidents?
Yeah, look, 12 is a practical speed limit. At 10, The device can be a little unstable and not so manoeuvrable. So we thought bringing it down by 50% by halving it was a pretty reasonable thing. It allows people to get where they want to go a little quicker than walking, but not too quick. So I think it's a common sense measure. We don't want people riding them on footpaths in an unstable way, and we thought 12 was about right.
Just to clarify, so it's enforceable, the speed limit is enforceable, so a police officer can say on the footpath, excuse me, you're going too fast, but they can't handle the fine out. Is that, just to clarify, is that right?
That's my understanding of the current situation. So, but we want to ensure that is much more enforceable in the future. The enforcement has generally been about the higher end of the speeding. So, people that are just rocketing through here at 40k or whatever, I've seen that. I think most people have used a bike path or a shared path, have seen the occasional cowboy come through, at a rate of knots. That's generally been what the enforcement has been about. But the footpaths, we want to make sure that people are doing the right thing. So I know the companies will be educating users, and look, I think that's an important measure going forward, that they get that message from the people that they're hiring it from. And we'll work with police around enforcing that on footpaths. Obviously, we would target it. We wouldn't be doing it just anywhere. We'd be doing it where there's a particular issue, probably a higher volume area that would be appropriate. Happy to do other matters. I think we covered that pretty well. Thanks so much, everyone. Yeah, lovely. Thanks. Cheers. All right, other matters. Sorry, you just have to talk up with the traffic, but yeah. Yeah, look, we've invested heavily in mental health services. We've got another additional 106 million going in over the next 4 years. It is a really important area. The government prioritises mental health. We established Jacaranda Place as a specific facility for people with severe conditions. It's a really difficult area. There's no doubt about that, especially for parents and relatives. But we are very committed to ensuring that the resources are there. Look, I think there's a strong array of services. Can we do better? We always look to do better in this regard. It's a big state. We're very decentralised. We like to ensure that our health services are as good as they can be. I think when you compare our health services to many places around the world, we are a universal healthcare system. It's one of the best in the world, but we always want to do better.
Do you think former public servants should be able to testify during the integrity review?
Well, there's already provisions in terms of public servants being able to make complaints if they wish to, and we've got very robust provisions for them to do so. We've got one of the strongest array of robust institutions in the country, and they certainly have a lot of opportunity to do so right now.
During the current review that was announced on Friday, do you think public servants should be able to testify?
Well, I think there's provisions now for people to do exactly that. I think Mr. Coldrake's role will be looking at the interrelationships in terms of the accountability framework. It's about making sure that it's fit for purpose. And we've already got a number of different measures being looked at in detail in their own sense. But this is Peter Coldrake will be looking at the framework overall and the interrelationships between them.
Why not individual complaints? Why would you want them being able to testify?
Well, because this is about how the framework works together as a totality. So while we've got individual issues being looked at by the appropriate authorities and the appropriate independent agencies, we need to make sure that they're all working together as a cohesive whole. That's really what Professor Coldrake's role will be. He is a respected person right across the spectrum. He worked for governments of different persuasions, been commissioned. He's currently a commissioner on a National Education Board with the current federal government, who's obviously not at the same political stripe as us. So I think his respect across the board in terms of his contribution to the public sector is absolutely unquestioned.
The Premier announced this on Friday. Do you think she delayed it too long? Would it not have been announced sooner?
Oh, look, I think it's an appropriate announcement by the Premier. I think she's been somebody who has put through integrity reforms consistently through the Queensland Parliament throughout the time as Premier, and they've been voted against every time by the LNP and David Crisafulli. I mean, the LNP actually took some of our integrity reforms to the High Court and lost. So they can talk integrity all they like, the LNP, but when they vote against it. So they've got no integrity when it comes to integrity.
Why do you think there's a need for an inquiry?
Well, I think every government needs to ensure that our public sector is fresh, is fit for purpose, and is doing the best it possibly can. I think every so often the public sector should be looked at to make sure that we're working well. Every organisation needs to protect itself against drifting and for things to be ineffective over time, and what we're doing is doing a refresh here and making sure we're fit for purpose. The integrity measures brought in by Labor governments over many years, we want to make sure that they're working well.
Should people on public service and like someone be able to testify during the inquiry and their years of experience in the roles?
Well, I think that Mr Summerall and a number of other people have made complaints, and they are being investigated in detail by the appropriate authorities. So I think we should just let them do their work, and let's see what the outcome of it is, and then if there's measures that need to be done, then obviously they'll be looked at. But they're already being investigated right now, and that's appropriate.
Mr Summerall's been speaking out today. Do you harbour any regrets about your anger that you've since emailed him?
Oh, look, benefit of hindsight, we'd all like to do certain things better, of course, but I apologise fully about this matter in 2017. I was cleared in 2017, and yet here we are, the LNP is still talking about it 5 years later, about a matter that was investigated by an independent agency, which I fully cooperated with, and was cleared. So, when it comes to integrity, their record is pretty clear. David Crisafulli gets up every single day and deliberately distorts and misrepresents and sometimes outright lies about the government press conference of the day, and then has the hide to talk about integrity. I mean, this is the guy who voted against every integrity measure in the Parliament for the last 5 years. I mean, he's a hypocrite.
What exactly is the opposition media lie about?
Sorry, a little louder.
What exactly does the opposition media lie about?
Oh, well, he said that RTI officers were not independent and located in ministerial offices. And when I called him out on that, he stopped saying it. He didn't say sorry, he didn't correct himself, he just stopped saying it and he moved on to other things. He said a whole range of things in press conferences that are just absolute misrepresentations of what's actually been said. So if he wants to talk about integrity, maybe he should actually start behaving with integrity and being fair about his criticisms and not verbaling people day after day after day. You watch him. He'll go to a press conference, he might well do it today. I've called him out on it, he probably won't do it today. But he often misrepresents what's been said by government ministers, and then has the hide to talk about integrity. I mean, the guy is a hypocrite.
Thank you.
All good? Fantastic. Thanks everybody. Thanks for coming with us.